I'm here with Sarah Gareau and Marissa Roberts. Sarah is the immediate past president of the Women's Caucus here at APHA, or associated with the APHA. And she also has a role collaborating across all the caucuses. So,
Right.
Sarah, tell us a bit about yourself and how you wound up in the caucusing system and your background.
Yeah, sure. So I am an MCH policy analyst by trade. I work at the University of South Carolina. And when I'm not at work, I'm very passionate about women's health and rights and the humanity of pregnant and parenting pregnant women. And the caucus was a friendly space to discuss those often emerging and maybe not discussed within APHA issues around women's health and humanity. And there I really found my home within APHA, and I'm actually running for the executive board this year. So it became, the place I came back, that safe space to talk about women's health and to find people who really shared that passion for feminism. The Women's Caucus initially started because APHA wasn't yet ready to talk about issues like abortion. I'm so happy to say that now there are many sections that are willing to have those tough conversations. But at the start, that wasn't the case. And so that kind of, our founding around such a contested topic has kind of led our future. So we're always the ones kind of pushing the boundaries on what do we want to say about women's health. And I think in recent years, really, that science of women's health inquiry, matching it and ensuring that we're including all. Because the founding stories of the Women's Caucus, it's unfortunate, but everyone looks like me. And that's something that, I'm really proud to say that both in leadership and in membership and the topics that the Women's Caucus covers, that we've really changed over time.
Tell me about when the Women's Caucus was founded.
So we're about to come up on our 50th anniversary in the early 1970s, and there's a little contesting about when we actually founded, 1971, 72. People came together with just flyers at the beginning and said, hey, APHA hasn't come out, this was right before Roe v. Wade, on this topic of reproductive rights, and a core group of really strong feminists said we need to develop our own caucus.
Yeah, I'm curious, you said APHA was unwilling to talk about that. Can you tell me more about that?
Yeah, so I think as an association in the beginning, my understanding was that they were worried about what their collective membership might feel about that issue, and since have been very supportive, both in federal legislation, legal documents in support of reproductive rights. In fact, it's one of the key tenets of our advocacy for APHA. But at that point, it was still, there was nervousness around the topic, and how far was APHA willing to be the external face on that topic.
Sure.
And so the Women's Caucus became the safe space for that.
And Marissa, tell us a bit about yourself.
Yes, thank you. So I am Marissa Roberts. I'm a Doctor of Public Health candidate at Florida A&M University in Tallahassee. I am also a health educator consultant at the Florida Department of Health. And I too, like Sarah, I am passionate about women's health, specifically maternal and child health. So for my dissertation right now, I'm exploring infant mortality from the perspective of Black women, and just getting their perspective on why they feel this disparity exists. I think as researchers in the field, we are quick to exert our opinions on the communities we serve, like women. And so ensuring that these communities have a seat at the table and that they take onus on, what's important for them for sustainability in the future. So.
Great. And I assume the Women's Caucus and Women's Health is about a broader set of...
Yes.
So can you tell us some more about the different women's health issues that you focus on?
Yeah, so I think very much in the beginning we were focused on reproductive rights, but women's health is much broader than that. Before there was a cancer forum, we were this space for cancers centered on women, so breast cancer and HPV and ovarian cancer. This particular year, we have a really important session on perinatal mental health, and it's such an important topic as we talk about severe maternal morbidity and mortality prevention. Last year, we were the main group at APHA that talked about the rights of young children to have access to menstrual care products in school, and some work that was happening in Chicago around that. That was actually promoted in the media nationally. And this year I'm so excited because everybody's talking about why don't kids have access to tampons, the tax on menstrual products. And so we're really proud of that work. We also, for a long time, we were the first to talk about sexual violence in the military. We had a session focused on transgender women's rights and really moving beyond gender identity conversations to talk about all women and not just traditional.
Talking about transgender, is that male to female, female to male, or both? And are there differences?
Yeah, anybody who would identify as women in that.
Okay.
Yeah, and we actually collaborated with the LGBT Caucus on that work.
Oh,
yeah.
How interesting.
So really moving to talk about person-centered language and where we're going with that,
Right.
Which for myself is actually something that I have to challenge myself. I'm so used to talking about pregnant women and women's health, and kind of moving beyond that now.
I see.
Yeah.
And you're working on some trans caucus work. Tell us a bit about that and your current role.
Yeah, so I'm the chair of the Caucus Collaborative. We have 17 caucuses in affiliation with APHA. The caucuses, as you know, center around either socially defined groups, and some examples of that would be the Black Caucus of Health Workers. Marissa's actually going to their meeting pretty soon. They just celebrated their 50th anniversary, and we're so excited about that. And the Latino Caucus, which has worked with the documentary. And then also social justice and worksite issues and other issues of justice. So some examples of that are the Homeless Caucus, the Veterans Caucus, and the Veterans Caucus is actually our newest caucus. So we have a wide range. So we need a space where we can figure out our needs, our assets, and how we can work collaboratively to push the needle on social justice collectively. And also how we can communicate in partnership with APHA. Because we're outside of the framework of APHA, sometimes we just need to have that space to kind of know what's going on.
Right.
So one of our big projects last year was to talk about our past and our future in health equity. We all share, almost all of the caucuses share an interest in advancing health equity. So we had a special session for that. And this year, we're really focused on our collective history. So we're working with Jay Glasser with the APHA History Project. And what really, this became important because I was trying to find the founding stories of the Women's Caucus, and they were lost. People had written them on, in paper and pen. They had flyers. And so I've been on my own path this year with that project to try to just find those founding stories. And I think that the work you're doing here is so important because in 50 years, we'll be trying to find a documentary. I appreciate it. So we've all been kind of trying to capture these narratives and ensure that our space within APHA is recognized as valuable. APHA is doing some really wonderful work to talk about organizational effectiveness. How can we collectively pool our resources to meet APHA's mission, right? That's so important. We have 53 different components doing some of the same work. For instance, this year the Women's Caucus worked on a consensus statement around state-based abortion bans, but so did Sexual and Reproductive Health Section. MCH was interested in this, the Public Health Nursing was interested in this, and so how can we as members collectively work on issues together? So that's really important, in terms of managing staff and funding and resources. But in that conversation, they're working only with the traditional membership groups, so the 32 sections. And it was explicitly said that the affiliates and caucuses would not be a part of the organizational effectiveness. So we're really, that's where we're headed next year as the collaborative. It's just ensuring that those historical narratives around identity, around place, around social justice are a part of that efficiency conversation and that they don't get lost. Because the issues of racism, the issues of sexism, they haven't gone away. And if anything, they're more salient today than they were then. They continue to be pervasive in society. So that's really something that we're really working on, is how to collectively talk about why we should have a seat at the table, and ensuring, for instance, inclusive, equitable pathways to leadership. That the people that run APHA represent our membership, that consumers are at the table, that practitioners are at the table, And there's a lot more work to be done to kind of get to that space.
I see. And Marissa, are you a member of the Women's Caucus as well?
I am not yet, but I will be joining soon.
Okay, yeah. So, and how did the two of you meet?
So I was actually provided the opportunity with the MCH Maternal and Child Health section to be paired with the mentor. And so they paired me with Dr. Sarah, which I feel is an amazing opportunity. And we share a lot in common, so I thought
I'm excited about it.
as well.
And Sarah, I believe you're a professor. Can you tell us a bit about your work as a professor?
Yeah, so I actually, and this is fitting given my work with the caucuses, kind of work in that space between practice and academia. So I'm what they call an applied researcher, and I do rapid cycle evaluation with the Institute for Families and Society. So those who are kind of in agencies, and Marissa is one of them, they don't always have access to the data, and they can't always answer quickly the questions that they need to answer in order to move practice forward. And if we wait for the science of public health, which is so important in driving the dialogue, it could be 3 years later. So the institute that I work for, we do a lot of data translation and visualization to be able to, in real time, answer questions that kind of move practice.
And which university is the institute associated with?
We're with the University of South Carolina.
Okay,
In
great.
Columbia, South Carolina. And then my particular passion within that is maternal and child health. That's why we're buddy together.
Okay.
And I'm very passionate about healthcare and system interventions and consumers interventions that would reduce severe maternal morbidity.
Okay. And how many members are there in the Women's Caucus?
So we have a little over 400 members.
Okay.
Collectively, the caucuses, I actually just asked for some data on that. And, you know, the number of members varies by group, but we have over 7,200.
Across the caucuses.
Across the caucuses.
Wow, that's a significant number of folks.
Right.
And how many people come usually to the conference?
Yeah, so I think that that's one of the things. A lot of our members are in community doing grassroots work around advocacy and policy and access to healthcare, and the actual meeting could be cost prohibitive. They either have economic barriers or financial barriers to be here. I can speak on behalf of the Women's Caucus. We're really excited that we have 20 people coming to our dinner tonight, and I'm about to go to the Women's Caucus business meeting, so I'll have a context of how many more people. But we always have a lot of people submit to our annual meeting program and don't seem to have a problem at all with interest or having people at the table.
What would the two of you say is the most important women's health issue today?
Okay. So personally, I believe that we have been trying to have a conversation about race and place in public health for a really long time. And I'm really proud of the fact that here at this meeting, the public health nursing section had a pre-conference to talk about that, and that next year they'll be talking about racism and maternal mortality. So to me, the ongoing social stress, generational stress associated with racism, that ultimately relates to the social determinants of health, that ultimately, you know, is this thing called health equity, and rapid aging, and the impact on infant mortality that Marissa can tell you about. That is the core thing that across the caucuses we would like to address.
Marissa, what would you say today's most important women's health issue is?
So I would actually concur with Dr. Sarah. For me personally, you know, there are a vast array of women's health issues and diseases, maternal mortality, maternal morbidity, infant mortality, and the list goes on. I think the issue is we know the problems exist. However, there are not a lot of solution-oriented dialogue around the areas. And so I think right now, in terms of women's health, like you stated, you know, we need to talk about racism. We need to name these isms, and we need to name those distal factors that are causing these issues, are the root causes of these issues, and address them and come up with solutions.
Right.
Thank you. Anything else on women's health you'd like to share?
Yeah, so I think that the field of public health is predominantly women. But women, in terms of professionalism, still struggle to have a space and to feel confident in that and to not feel inferior and to feel like they are heard. And so I think that concurrently we need to talk about women's health outside of APHA, but we still have so much work to do to ensure that women's voices are heard within APHA. And so that's another area that I think that we'll be working on.
Great.
Yeah.
Well, nice to interview both of you.
Thank you so much for your time.
Have a good conference.
Thank you.
Yes. Thank you.